annual Rutgers Institute for Health Catalyst meeting. And this meeting is really being about 8-month planning. And we're delighted to share the next 2 days with you. My name is Xingqi Dong. I direct the Institute for Healthcare Policy and Aging Research. By training, I'm a geriatric physician by training, and this issue is enormous importance, not only to the Institute, but to my own work and all of our work collectively as well. I'm going to kick us off with a bit of introduction about the Institute, about the Catalyst program, about the importance of PBRN, and then we have a wonderful set of speakers today with us, and that I'll introduce. Before we do that, I also just want Anne to wave your hands. This is Anne Wen, who is one of our faculty in the Institute, who's going to help to run tomorrow's session, and she also helps to lead the PBRN initiative. And Oliver, if you can wave your hand as well, who's one of our project managers here at the Institute, who's helping with the logistics. So he'll be helping to mute, unmute, and cut and pasting things into the chat as we go through the day. Institute for Health is a very special place. I'm embarking my 4th year at Rutgers. Previous to that, I was in Chicago for more than a dozen years. And what really drew me to the Institute, not only the fact that it's a well-known institute and a reputable institution, but really the diversity of the disciplines and faculty we have. Institute started about 35 years ago back. We currently now have close to about 190 faculty from 30 different disciplines and schools and units, where it's very common to have an anthropologist sitting next to a sociologist, sitting next to a psychologist and nurses and docs, and talking about similar issues. And it's really that theory-driven research and making it applied is what the Institute really makes it more unique than many of the institutes across the country. And over the last 3 years, we've grown tremendously. Just from a faculty recruitment perspective, we've recruited about 20 faculty from all over the country to join us at Rutgers, and the countless staff that accompanies those initiatives as well. And within that is the framework of the Catalyst. Catalyst program started about 3 years ago back. And the goal of the Catalyst program is really to bring a pivotal issue that are of importance, not only to the Institute, but to the university, really give it a platform where we can really brainstorm this issue, come up with subsequent solutions to solve different problems. Give you some of the examples of the things we've done. Our first Catalyst program was focused on healthy aging, where we brought over probably about 100 and 150 faculty together from all over Rutgers University and state to talk about issues that are relevant to health and aging. From that initiative, a center within IFH will be formed. Many of the faculty cluster hires are focused on healthy aging. And the next Rutgers capital campaign, the $2 billion capital campaign, the big idea, the $50 million idea, the healthy aging was able to compete to be one of the 12 university-led capital campaign ideas for the institution moving forward. The New Jersey cohort study is also a wonderful example of how a Catalyst program have helped to shape not only the conceptualization of a New Jersey cohort studies, but to the realization and generous funding, not only from the Robert Johnson Foundation, but from the university, that culminated into a $10 million project about to be in the field of collecting data on 10,000 individuals throughout the New Jersey, focused on interconnectedness of trauma, resilience, and health outcomes, and truly a translational study. In terms of this Catalyst program, we very much hope to do the same and to really establish framework that really have longevity rather than a individual symposium itself. And the Catalyst program, in thinking about PBRN, the practice-based research network, New Jersey is a very special place. You know, we're one of the wealthiest state in the country in terms of per capita, but we're also ranked one of the worst in the country in terms of health disparities. And when you think about life expectancy between Trenton to Princeton, you know, less than a dozen miles away, that we have more than a dozen years of difference in life expectancy. And so the disparity is huge. And New Jersey has just about 8.8 million lives in New Jersey. There are 24 health systems, including 9 that operates in multiple states and 15 that operates in New Jersey alone. There are more than 4,400 medical groups. There are 23 federal qualified health clinics and satellite facilities that provide care to 51% of uninsured population. There are almost 31 active healthcare providers, including almost 15,000 in primary care and about 16,000 in specialty care. So there's enormous opportunity here, and you're going to hear our speakers to speak about their perspective uniquely. Over the last year, we've embarked on a lot of different breadth and depth of work in terms of starting this initiative. And to date, the New Jersey PBRN has initiated deep communication with 8 different health systems and medical groups, ranging from the New Jersey Department of Health Division of Consumer Community Services to New Jersey Primary Care Association, to New Jersey Health Quality Institute, New Jersey Hospital Association, Medical Society New Jersey Hospital Alliance, New Jersey Innovation Institute, Rutgers, variety of different units, Barnabas Health, who's one of our key partners. You can hear quite a bit today. And ultimately, the New Jersey Practice-Based Research Network will affect New Jerseyans by facilitating working relationships amongst healthcare systems, medical groups, healthcare providers, and researchers to answer population-based healthcare-related questions. And Ann and Oliver have been working with many of you over the last year to get us to this point. And this is really a culmination point for us to be able to kick off formally event based on the work we've done. And you're going to hear many of the speakers who's been intimately involved with us for the next 2 days. And in terms of the speakers, we have 4 keynote speakers, 2 of them today, 2 of them tomorrow, who are introduced. I'm going to introduce Dr. Sharif Anahal in a moment. But we also have Dr. Andy Anderson with us today, and tomorrow we will have Dr. Richard Barron, who is the president and CEO of American Board of Internal Medicine and the ABIM Foundation, as well as Dr. Alonzo Plow, who is the Vice President of Research Evaluation and Learning and Chief Scientific Officer of the Robert Johnson Foundation, who is also has been a wonderful supporter and the funder for the New Jersey cohort study.